Good afternoon. I'm Dr. Adarsh, oncologist. So today we are launching our brachytherapy services. So brachytherapy is also called internal radiation, where the radiation is delivered very close to the tumor, either directly or through the applicators which are placed earlier. So brachytherapy, we can use it for treatment of many cancers like the head and neck cancers, the tongue cancers, the cervical cancer, the endometrial cancer, breast cancer, and many other cancers. It can be given alone in early tongue cancers, or it can be combined with the external beam radiation, so which increases the chances of tumor cure. So it is the treatment duration is very short with it, and our facility is accredited with the NHIF, so the people can utilize the facility in achieving good tumor control.
When you look at the cost of treating, let's say, for example, cervix, after external beam radiation is the radiation that you use, either cobalt, you use linac, you use any other forms that gives radiation externally, and the cost of the brachytherapy, you put the source inside the body. For external beam, you normally use 25 sessions, 35 sessions, or 35 fractions. The patient comes for 35 days every day. But for brachytherapy, because you're limiting your radiation to only that area, it means you can deliver a high dose, and the number of sessions a patient comes to the hospital, they are actually quite minimal because of that. So, for example, in brachytherapy, it is normally given 3 sessions, 3 treatments, and the cost is probably 150,000. And the patient comes, we perform this examination in a theater kind of an environment where strict kind of sterile environment is needed, because you are opening cavities of a patient to insert the source, and it is manipulated by a machine that you direct the machine that I need to treat to this area, depending on how you planned it, that the radiation is delivered. The patient stays in a hospital for about 2 or 3 hours. If the patient is all right, then they can go home. So it's an outpatient a procedure that a patient doesn't need to be admitted. So there's no admission cost, there are no any other related costs, and only a small amount of sedation is needed when you're doing insertions, when you're doing the procedure. So if you look at the cost outcomes versus the treatment outcomes, it's a way cheaper. It's because at the end of it all, it is easy cost-wise to treat an early stage compared to when the disease has progressed. It becomes more expensive to treat when the disease has expanded. So when you have the overall picture of using brachytherapy, the costs to the patient, the cost to, let's say, NHIF will come down, and the cost even to the families, because this disease is quite expensive. It's psychologically involving. In all these spheres, it's a very expensive disease if you look in all perspective. So with this, the overall picture is that the long-term effect, the long-term outcomes will be cheaper.